previous visit by MMC last year, we were told that MMC may implement a common examination for foreign medical graduate prior to being allowed to do housemanship in Malaysia. So what is the current stand on this? Something like USMLE. And second question is, if after my I finish my housemanship and I continue my PG postgraduate in India, is it
you mean you go back first and come back here?
Yeah. Is it qualified by Malaysian government?
Okay.
I think these are valid questions. The first one is common exam. Actually, we are in the process of tabling our revised medical act to Parliament. And in the revised medical act, it's true that we will conduct a special exam, a licensing exam for all foreign doctors before they do the housemanship. Now why we do that is not to cause problems. It's just that now we are recognizing about 343 or something like that. So many foreign, we cannot be visiting them. Some don't exist anymore, like Baghdad and all that. But it's still on our second schedule as recognized colleges. And each time we get calls from Slovakia lah, Czech Republic lah, Slovenia lah, Romania lah, macam-macam, ask us to visit and all that. So in order to solve the problem, you can go wherever you want to go. And Mara sometimes send people to Romania, even though Romania is not recognized, and then thinking that we will recognize them. Okay? So because of that problem, we felt that now, as in done in most countries, you go wherever you want to go. But when you come back, you sit for a very simple licensing exam, conducted by the Malaysian Medical Council. If you pass the exam, then of course, then you enter the housemanship period. Okay? So this is what we plan to do. And of course, certain universities may write in to say that, you know, we don't have to, our students do not have to sit for the exam, and they have to give good reason for that. If they give good reason for that, we may exempt one or two of these universities. Alright, but it has to be evidence-based. So that is the plan. It hasn't been effected yet. It hasn't gone to Parliament yet. Okay? But I don't think any of you will have any problem. They might ask about Wilson's disease. The second question was postgraduate in India.
Yes.
Now, depends on what you're going for. Now, I'm not so sure whether the courses conducted in Bangalore are recognized yet by the Health Ministry. We don't know yet, because what normally happens is they write in, and then we will look at the curriculum, and then we will say yes or no. But that is for the basic basic postgraduate. But for subspecialty, there's no problem. Like I know, this morning we visited one gym with a very strong vascular surgery, very strong in fetal and maternal health, very strong in pulmonology. Obviously, if you want training in that area, you can go there. That is for subspecialty. But for basic postgraduate, it is usually run by the universities, whereas the subspecialty is run by Ministry of Health and Academy. So that one we can recognize. But for the basic postgrad, it is by the universities. Okay? So if my advice to you is come back and then see how you feel. You want to come back here, you do your 4 years, and then you can come back here and do pulmonology or vascular surgery or pediatric neonatology or whatever you want to do. There's not a problem. You can come back here. Because the standards here are very good. It's not a problem. 1, 2, any more questions? Now, yeah, you all won't be affected because the exam you all won't be affected. Because even if it is imposed, it'll take another 8 years or 9 years before it is affected. So you don't worry about it. Yes. Okay. So the local ones are exempted. This is what we think. They may be debated in Parliament. I cannot be speaking. Because this thing hasn't gone to Parliament yet. In Parliament, people might start saying this and that. They might not even agree with us. They might even reject it. We don't know. So that's why I don't want to say too much. But I don't want you all to worry about it. Because you won't be affected. Alright? Don't worry about it. Okay, it has gone. It'll take years. 8 years, 10 years before you see anything. And that has to be debated first in Parliament. Okay? Thank you very much, and work hard, and I look forward to seeing some of you when you come back as graduate doctors. So take care, work hard, and remember, you owe it to yourself, you owe it to your parents, and you owe it to the profession, and you owe it to the country to become excellent doctors. Alright, and I'm confident all of you will become just that. Thank you very much, and I would like to again thank Professor Datuk Shukri, the Ghani, Sidu, and all the rest of the faculty members for taking care of all of you and making sure that you get the right medical education. Thank you.